Hi guys, my name is Hannah Mercrelis. I'm a student physical therapist assistant at Jeff State. Today I'm going to be talking to you about Alzheimer's disease. So before I dive into this actual disease, I want to talk to you about why I chose this specific disease as my topic. So this has a personal factor for me because both sides of my family actually has Alzheimer's. Both my mom's mother and my dad's grandmother both had it before they died, and so I got to see it as on a family side or loved one, seeing that progressively get worse and how that affected my mom and my dad and my whole family. And apart from the personal aspect, I also got to work at my skilled nursing, I got to work with these patients who were in the Alzheimer's and dementia unit specifically for them. And I really enjoyed working with them. They were the best part of my day, and so that was what sparked my attention to Alzheimer's disease. So I'm going to be talking to you about the pathology of this disease. I'm going to be talking to you about what causes it, how do you diagnose it, what are the statistics, and what population is most affected, as well as some PT interventions that we can provide and medical interventions that these patients can seek as well. So first, Alzheimer's disease is a neurocognitive disorder, which is defined as a type of dementia that affects cognition, memory, and behavior patterns. AD is essentially driven by two hallmark processes, first being the extracellular deposition of beta amyloid, which I'm going to say a lot in this presentation, as well as intracellular accumulation of the tau proteins. And essentially these proteins in the brain are only present when you are diagnosed with Alzheimer's disease. So these beta amyloid proteins are essentially toxic to the brain and specifically affect the hippocampus, which of course houses our memory storage and how we remember things. After these proteins have been present, they create two main lesions. And they have been termed senile plaques, which is like the hallmarker sign for Alzheimer's, and the neurofibrillary tangles. So what causes AD? Of course, we all know old age plays a major factor. As we age and get older, our processes slow down, so this is going to be the major factor in this disease. A lot of research suggests that most cases are sporadic, and the etiology is still unknown and unclear. Which makes this such a frustrating disease in diagnosing and living with it. Some research has been trying to prove if there's any genetic markers for this disease, and they found that this specific gene called the amyloid precursor protein, or the APP gene, is found on chromosome 21, and we all know chromosome 21 is a part of Down syndrome and diagnosing Down syndrome when you have a mutation on that gene. Research suggested that these patients with Down syndrome also had a higher chance of developing AD, actually 1.5 times more likely, because this APP protein was present on this 21st chromosome. So I thought that was really interesting on the gene aspect of this disease. Also, there's a lot of research trying to be proven to see if there's any environmental or diet factors in developing this disease as well. So diagnosing AD is very hard. You can't get 100% confirmation unless you have a histologic evaluation of the brain tissue. So traditionally MDs look at a certain criteria these patients have to make. A couple of them are deficits in two or more cognitive or cognitions or areas of cognition. That includes memory. Gradual onset, they were looking at months to years, not just a few weeks, because this is a progressive disease, so it takes a long time for this to develop. Making sure there's no disturbances of consciousness, making sure that the patient is at least over 40, because that is for early onset Alzheimer's. And we're also looking at making sure there's no systemic or brain disorders already there. So they're looking at tumors, or if the patient has had a stroke. So they're going to be using imaging and PET scans and MRIs to kind of confirm not having those type of diseases or markers. Next, in diagnosing this, they can perform, genetic testing, biomarkers, but it takes a lot of time and it's very expensive to do this, so not a lot of people do that. Not a lot of people choose this option. So some statistics and facts of AD, which I thought were really interesting, is that AD is actually the 6th leading cause of death in the United States, which I thought was shocking. 1 in 3 seniors will die with AD, and AD kills more people than breast and prostate cancer combined. It's also estimated that 10% of people who are 65 and older have AD, and that number is increasing daily because the population is increasing and people are living longer. So that leads me to who's most affected with AD, and I found that women were 2/3 of Americans were women who were diagnosed with AD, and that's research shown that that's because women live longer compared to men, so they're 2/3 as times likely to get this disease. So of course, population over 65 years old, early onset being between 40 and up. Most commonly in Western Europe, but North America is right behind it. Woohoo. African Americans actually were twice as likely, and Hispanics were 1.5 times more likely to develop this disease than whites, which I thought was an interesting statistic as well. So some PT interventions that I think would be beneficial is that these patients are going to have a lot of fall risk. So they're going to have balance issues, they're going to have gait pattern issues. So we're going to be looking towards increasing their muscle, increasing their flexibility, increasing their independence with their ADL. So, and also just looking at general conditioning, making sure we're getting them active. And when we do that, that's increasing blood flow to the brain. And so that's actually increasing blood, and it's going to help them remember more or not cause their symptoms to escalate. Next, some of the helpful tips that I found while working with these patients in my long-term clinical, try to step into their world, try to find their strengths and play toward that. Really get to know the family members, get to know them, get to know what their likes or dislikes are, and really play towards that in your therapy. So figure out what they like to do, what they like to eat, what they like to, watch, and contribute that to obtaining your goals for physical therapy. And that I found was most helpful when treating these patients. And also smiling as often as you can, which is kind of weird if you think about it, but these patients have difficulty remembering, and they have difficulty with their short-term memory. And so they may have difficulty with that, but they don't have difficulty with remembering how they felt, remembering how you made them feel when we were doing this activity or when we first got introduced. They don't forget that. So making sure that's an important role, and making sure you're a friendly face for them so that they're not scared and they are confident in your abilities and what they can potentially do as well. So some medical interventions, like I said, it's hard to diagnose, so it's usually diagnosed by a neurologist or a specialist in the geriatric population. And they usually prescribe choline esterase inhibitors, which has been proven to or may improve neuropsychiatric symptoms such as agitation and depression. And so overall, that can help attribute to their mood and get them engaged more instead of sitting at home and not working their muscles or increasing their flexibility. And I've listed 2 drug options. The first drug is Aricept, and that's usually their first line of defense when they first get diagnosed. And then for the more progressive stages of AD, they select the Rezidine drug. And also, these doctors need to put in perspective of a multi-discipline approach. These patients may need, a long-term care facility or PT, OT, and speech. So making sure that you're advocating for the patient, but the doctors also know what they need as well. So let me know how I did. Any questions or comments with Alzheimer's disease, I'd love to answer. And here is my references. Thanks.